Hello everyone. So today we will discuss about the part 2 of corrosive poisons, that is organic acids. Now the first organic acid is carbolic acid. It is also known as hydroxybenzene, phenol or phenyl alcohol. The physical appearance is it is pure. When pure, it is colorless, prismatic, needle-like crystals which turn brown and liquefy on exposure to air. It has sweetish burning taste and a carbolic or phenolic smell. Commercial carbolic acid is dark brown liquid containing several impurities, chiefly cresol. Derivatives of carbolic acid are lysol, catechol, cresol, menthol, thymol, dettol. So now you can also tell its uses, like it is used for antiseptic and as a disinfectant. It is also used as a preservative in vaccines and sera. The household phenol contains 5% phenol in water. Fatal dose of carbolic acid is 10 to 15 gram or 20 ml. Fatal period is 3 to 4 hours. Now, clinical features of carbolic acid poisoning. Acute poisoning. Poisoning by carbolic acid is also known as carbolism. Local effects on skin. It causes typical odor in the vicinity of patient. Corroded area of skin and mucosa shows grayish brown discoloration, and it produces white opaque scar. It causes burning and numbness due to damage to nerve endings. The second effect, local effect, is on digestive tract. That is, it causes hot burning pain in mouth and stomach, and in respiratory tract it causes irritation and dyspnea due to development of pulmonary and laryngeal edema. Now, systemic effect of carbolic acid poisoning. It is a CNS depressant, especially to respiratory center. There is a respiratory alkalosis and metabolic acidosis. Carboluria. Urine is scanty and contains albumin and free hemoglobin. On exposure to air, it turns green due to phenolic metabolites, that is hydroxyquinone and pyrocatechol. And it also causes euchronosis, that is these pigments, that is hydroxyquinone and pyrocatechol. It causes pigmentation in cornea and cartilage. So this is how the urine looks due to phenolic metabolites hydroxyquinone and pyrocatechol. Now, chronic poisoning, also known as phenol marasmus. It is characterized by anorexia, weight loss, headache, vertigo, dark urine, and pigmentation of skin and sclera, that is euchronosis. Now, how to diagnose phenol poisoning? Urine is collected and stored in a transparent container which shows greenish discoloration. And if you add a few drops of 10% ferric chloride to 1 ml of urine, it will show blue color. Now the cause of death is, first is syncope, second is asphyxia due to failure of respiration, that is edema of glottis, and complications like bronchopneumonia. Now the treatment of carbolic acid poisoning. If phenol falls on the body, clothes should be removed and skin washed with soap and water. Stomach wash is done with plenty of lukewarm water containing activated charcoal, olive oil, castor oil, magnesium and sodium sulfate, or 10% glycerol or soap solution. When lavage is completed, 30 mg of magnesium sulfate or 250 cc of medicinal liquid paraffin, it should be left in the stomach. Demulcents like egg albumin or milk can be used. Saline containing 7 gram of sodium bicarbonate per liter is given intravenously to combat the respiratory depression. And hemodialysis is done if there is renal failure. Now, what are the autopsy findings? The external autopsy findings are same as described earlier, like typical phenolic odor in vicinity of patient, corroded area of skin and mucosa, euchronosis. Now, internal findings. Mucosa of esophagus is tough, white or grey, corrugated and arranged in longitudinal folds. The stomach mucosa becomes thickened, swollen and covered by coagulated grey or brown mucous membrane, that is leathery appearance. It has also green colored urine. Other internal organs are consistent. So this is how the stomach mucosa looked. It has leathery appearance. Okay. Now we will discuss about the second poison in the organic poisoning, organic corrosives, that is oxalic acid. It is also known as salt of sorrel or acid of sugar. The physical appearance is as follows. It is colorless, transparent, odorless, prismatic crystal with sour, slightly bitter taste. In the oxalate form, it is natural constituent of many plants, that is in green leafy vegetables like cabbage, spinach, sorrel. About 20 milligram of oxalic acid is excreted in urine daily. Now, the uses of oxalic acid are: it is used as a bleaching agent and cleaning agent, it is used in calico printing, and it is used in removing writing and signature illegally, that is, it is a ink remover. Now, the fatal dose is 15 to 20 grams and the fatal period is 1 to 2 hours. The mode of action of oxalic acid. Locally, it rarely damages the skin but readily corrodes the mucous membrane of digestive tract, and in systemic it causes shock, hypocalcemia. The important feature of oxalic acid poisoning is hypocalcemia. It readily combines with the calcium ion in the body and forms insoluble calcium oxalate, which precipitate and accumulates in organs and excreted in urine, called as oxaluria. Renal damage. It causes renal damage because the oxalates which are produced, it gets deposited in the tubules and causes tubular necrosis, and death can be occurs from the uremia in 2 to 14 days. Now the clinical features of oxalic acid poisoning. As it has weak corrosive action of skin, but the mucous membrane of tongue, mouth, pharynx becomes whitened. It has hypocalcemic features due to calcium excretion in urine, that is tingling and numbness in limbs, tonic muscle spasms, convulsions, a cautious hand due to carpopedal spasm, and Chavostack sign is positive, that is spasm of facial muscles following a tap applied to facial nerve. Renal damage occurs due to tubular nephrosis or necrosis. Now, how to diagnose the oxalic acid poisoning? Estimation of urinary oxalate crystals should be done, and estimation of serum calcium and oxalate levels are done. Treatment. Decontamination should be done. Stomach wash is given with calcium gluconate or lactate. Antidote. Calcium gluconate or lactate is the antidote because any preparation of calcium which converts the poison into insoluble calcium oxalate. Okay, suspension of chalk in water can be used. IV calcium gluconate, that is 10 ml of 10% solution, is given at frequent interval. Parathyroid extract 100 units of intramuscular is given in severe cases. Demulcent drink should be given. Okay, autopsy finding of oxalic acid poisoning. Mucous membrane of tongue, mouth, pharynx and esophagus, they become whitened and has scalded appearance. Stomach is reddened and punctate from erosion or almost black. Stomach contents are gelatinous and brownish due to acid hematine formation. The kidneys are swollen by edema, congested, and tubules are filled with oxalate crystals. All other organs are